Carver, and today I'm going to be talking to you guys about why nurses should get paid more. Now, during this pandemic, nurses and doctors are putting themselves at a very high risk every single day they work. Now, the big problem is nurses do not really get paid what they deserve, especially during this pandemic and trying times as today. Every time you have been to see a doctor, I can almost guarantee you that you have come in contact with a nurse. My credibility for this is I'm aspiring to become a nurse in the future by getting my ASN, which is my associate's degree in nursing, and I'll be taking my NCLEX, which is my National Council licensure examination after graduation to become a certified RN, which is a registered nurse. Now today I'm going to be talking to you guys about 3 main points. Point number 1, what do nurses really deal with? Point number 2, what if they got paid what they deserve? Point number 3, what if they never get paid what they deserve? Now, nurses are in the news daily. They are critical, and I hope you'll agree they deserve more recognition. Now, on to the main points about nurses not getting paid enough. Main point 1, what do nurses really deal with? That's a question that not many people know the answer to, and not many people really ask. The only people who really know the answer are nurses themselves. Now, nurses do not get paid for what they deserve, especially during this pandemic. You have to think about everything that they have done to become a nurse, all their studying, hard work, all their sacrifices and timing that they've had to do to become a nurse up to now. Now, when they're in their lives every day working at hospitals, doctors' offices, they're putting their own body and immune system at risk to get a disease or whatever sickness the patient that they could be seeing has. Now, onto my research from the CDC, I have found out that 92% of HCP, which stands for healthcare professionals, have reported to having at least one symptom. Now, that is 4,336 healthcare professionals. But most healthcare professionals with COVID-19 were not hospitalized, and that was 90% of healthcare professionals, which totaled up to 6,760 people. But severe outcomes have come out of this, including 27 deaths. Since nurses have come in more contact with sick patients, they deserve better pay. It's plain and simple to the eye, just like that. Now, nurses deal with more sickness than we give them credit for. Have you ever thought about the type of sacrifices they make? What if they got paid for what they deserve? Nurses need to be paid for what they do in their jobs. Nurses risk way too much to not get paid what they deserve. Like I said previously, they risk their own immune system, their own health. But have you ever thought about them risking the people they come home to, their families and kids? They risk them contracting a virus, coming in contact with a virus or a sickness as well. Now, according to the U.S. Bureau of Labor Statistics in 2019, the median pay for a registered nurse was $35.24 per hour, which added up to $73,300 per year. Now, that seems like a pretty good amount of money, but compared to all the other people they work with in that hospital, that really doesn't amount to it, especially with all that they deal with and the sacrifices they make. Now, what will work? If they get paid what they deserve, it would help all nurses feel more valued and they wouldn't have to work as much. Therefore, they wouldn't be putting themselves at risk as much as they do now. Nurses are huge assets to the healthcare field and deserve much more better pay. Just imagine how nurses would be if they continue to not get paid what they deserve. Point number 3, what if they never get paid what they deserve? Imagine going to the hospital or the doctor's office and a nurse coming in and then just having the worst type of bedside manner you've ever seen. They're very rude and just aren't polite at all. They're clearly burnt out. If nurses continue to not get paid what they deserve, they get burnt out and become dissatisfied with their job. No one would want to have a nurse that's caring for them that is dissatisfied with their job and is not taking care of them or not doing their job well at all. Now with that, we've discussed the negative effects if nurses don't get paid what they deserve, and here's what you should do to help. You can show nurses how much they're appreciated. You can show nurses in many ways how much they're appreciated and what they deserve. First, you can educate yourself about how nurses are underpaid. Second, if there's petitions out, you can definitely sign those. And lastly, third, you can simply tell a nurse how much you appreciate them. Words have a big impact on people. Now, I will be going over the 3 main things that we talked about today. 1, what do nurses really deal with? 2, what if they get paid what they deserve? 3, what if they never get paid what they deserve? Nurses just simply are underpaid, especially during this time of COVID-19 with all the risk and the risk that they put themselves and their families and who they're living with. Now, nurses aren't only putting themselves at risk, but their families too. Thank you.